Dr. Claytor here, discussing the differences between a neck lift and a facelift. So here's our patient before and here she is afterwards. And in her case, she had both the combined facelift and the neck lift. Let's break down what these two different operations are. The neck domain is really everything that's along the jawline down into the neck. And one of the areas that can be so frustrating about the neck is the extra skin and the animation that comes from the platysma muscles. So down in the neck, what we have is a huge sheet of a muscle that extends across here like that. And that muscle can increase the activity and animation in your neck. It does not impact how you move your head. All it does is work as an animation muscle. Patients can also have a significant amount of fat in their neck, and they can have a significant amount of blunting of that cervical mental angle. That angle from your jawline to your neck is called the cervico-mental angle. With a significant amount of extra fat in here that is on top of and in front of that muscle, there can be some very significant technical challenges. Some people say, well, can you do my neck lift without opening it up? And I think it really depends on the patient whether or not that's possible. But many times, the best operation for contouring the neck is going to come from making an incision along here. So the incision would go jagged here, along here, down here, and then back behind the ear, and then back like that. That allows the skin to be lifted up, all of this tissue to be lifted up so that we can gain access. The other place that's very effective is to make an incision is underneath the chin to remove that fat directly. So you can go in, and we look down in there with a high-powered magnifying glasses and powerful lights, and we can actually look down in here and very specifically remove that extra fat that's in there. Now, there are a lot of other structures down here. There are a lot of muscles that are at the floor of the mouth. There are glands. There's a big submandibular gland over here. If you feel it underneath your jawline and you have a big lump, that's a big submandibular gland. That can be a real impediment to creating a beautiful contoured jawline. The platysma muscle, what we like to do with that is in the center, we unify it. And what that means is if you were looking at the neck from the midline, you have these muscles here. If the muscles have pulled apart and you have separation in there, then you can have significant platysmal banding. And so when you make an incision underneath here and you access these muscles, you can pull these together with sutures and unify them. So put sutures on there and pull them together so that now they come together here with one suture line. And you can understand by doing that, by tying them together, what it does is pulls them back like that. It pulls back. And so now, instead of having your jawline here, now your jawline is here because you've pulled these muscles back by securing them together. So this is obviously a front view, this is the side view. You take and release this platysma muscle from here. As you come in from the side, you release it so that now this part of that muscle is free floating. You can take that muscle and pull it up and anchor it back behind the ear. And you can see what that would do to the orientation of these muscles. So these muscle fibers are pulled together centrally, but then here, by releasing these muscle fibers and pulling them here, what you're doing is creating beautiful contour. Many patients will come in and they'll say, geez, Dr. Claytor, I would really like this. That is what this maneuver is here. That is the power of manipulating the underlying tissue. It's not simply a matter of pulling the skin. It's a matter of going down deep underneath to the platysma muscle, releasing it almost to here, and then taking that muscle and bringing it up and anchoring it back behind the ear in what we call the mastoid fascia. And that suture is a permanent suture that stays and lifts and contours and creates that beautiful jawline and what we call the gonial angle right here, that little angle between the angle of your mandible and down into your neck is called the gonial angle. And when you see somebody that has a beautiful shaped, contoured, chiseled line there, it's a sign of beauty and it's a sign of youth, and it's really what can create a very sharp and distinctly beautiful neckline. So that's what's going on in the neck. So when somebody says, Dr. Claytor, I only want a neck lift, I say, okay, this is what we're working on. Now let's talk about how the face ages as a whole, because very frequently we age top to bottom uniformly. And so the aging process that is most impacted in the mid-face are on the bones. And so we have what we call the zygoma bone right here. And that's your zygomatic arch. And as we age, this bone gets smaller. And as it gets smaller, everything that's resting on it drops down. And that's why we get malar involution, and it can actually really open up a tear trough and create very noticeable shadow contour and a deep tear trough. And many times patients will say, geez, I feel like I look really old because of this deep tear trough. And it may not actually be because of your eyes, but because your malar eminence is dropping. Now what's going on here in the midface is there is a sheet of tissue that is contiguous with the neck. And so down in the neck, it's called the platysma. In the midface, it's the superficial muscular aponeurotic system, or the SMAS. And so that sits in two different phases. You have the non-mobile SMAS and you have the mobile SMAS. And so imagine this tissue coming up here like this. And I'll draw it in two sections. So we have the non-mobile SMAS, and just think about it. When you go right here, it doesn't move very much. You come here, highly mobile. So when we want to address the midface and take a descendant cheek and raise it to a nice, big, high cheek that is a sign of youth by elevating that tissue up here, what we're trying to do is get this tissue, because remember, this bone shrank and everything fell down. We want to turn it around and go back up this way. We're going to dive a little bit into the difference between the SMAS plication and the deep plane facelift here. So with a SMAS plication, often you need to lift up much more tissue so that you can get at this SMAS. Because remember I said this is the non-mobile SMAS. So if you only dissect to here, you're not going to move the mobile SMAS. And if you're not moving the mobile SMAS, you are not creating this beautiful high cheek area. So you would therefore have to dissect quite a bit further out into almost to here. Not saying that's bad. It's, in my opinion, it's a lot of dissection of that very delicate skin that you're then pulling on afterwards. And all that skin that you've lifted has created an envelope of tissue that is now not nearly as well perfused and not connected to the deeper tissues because it had to be lifted to get access to the mobile SMAS, so that then a SMAS plication could be performed. And that's generally done where you grab some of this and you attach it up to here. And so effectively you pull these two together and lift up the mobile SMAS up and attach it to the non-mobile SMAS, or even up into the temporal fascia. So that's the SMAS plication. However, the deep plane facelift, which I'm a big fan of and what I perform, in the deep plane facelift, what you do is you really only need to dissect to about 3 centimeters out from the ear lobule. So you only really need to dissect out to about there. Then you drop down underneath this mass. You go down into the submass tissue. And the reason that's important is that you're leaving this mass attached to the skin. So let's draw a picture of that. I need another board. And going down deep to this, you can dissect into these different compartments and release the retaining ligaments. And so there are these retaining ligaments all across here. And if you were to take your face and try and move it, at a certain point it stops. And those are the retaining ligaments that are keeping that tissue from being mobilized. Now, the thing that you need to be careful of is that you need to know that there are big blood vessels and nerves, and they very frequently run right along where these retaining ligaments are. So these nerves that come out from here and supply the different motor functions to the face are running through this area. I don't think they're showing up very well, but the point is that they run generally very close to where the retaining ligaments are. And so again, we're using high-powered magnification to be able to look in here and release these retaining ligaments. So now that mobile mass can be moved outwards with the sutures. So we'll take this away. So this mass gets moved this way. And in doing so, you elevate this cheek volumization here by lifting and pulling up on the cheek to create that beautiful cheek contour. Aging was going this way. This is the way youthful rejuvenation is going. So the big difference between a neck lift and a facelift, in my opinion, is that a facelift generally includes both the neck and the face. If you're just doing an isolated neck lift, then you're focusing down here. The one area that we didn't really talk about is that marionette line, or those jowls that you really want to get and tighten. You can get them to some degree with a neck lift because you're lifting up to here and you're pulling here. But you can see this whole orientation is really much better accessed with the facelift. And then this down here is much better accessed just with the neck lift. Now, when you're doing the facelift and the neck lift at the same time, all of this comes up. But there are some patients who come in and say, look, I just love how my cheeks look. I'm not worried about doing anything about them. Perfect. In that case, you wouldn't need to do anything. So let's go to this patient here. She's actually the after for this patient, but she makes a good representation for somebody that might be a candidate for just a short scar facelift alone. And that would be somebody that has a great looking neck and really doesn't want to do anything to their neck. And in this case, the incision is very limited, generally along here, down along here, and it may almost stop here. And so there's really no dissection down into the neck, and you're focusing all entirely in the upper face area. And this can be extended, and you can go up into the hairline and make it a slightly higher SMAS application or access. For the mini facelift alone, you're really doing a minimal dissection. Sometimes this is called an S lift, and you can see this kind of looks like an S. There are a million different fancy terms out there for this, but effectively, this is a limited access, and you're not really going down to the neck at all. You may do a little limited liposuction down into the neck, but you can clearly see these incisions are not going to allow a lot of access into the neck. And so with a mini, you can go down and go past you have, remember again, the non-mobile SMAS and then the mobile SMAS, and you can go down and you can do your deep plane dissection and get down into these tissue planes and do your deep plane lift, just focusing in this area. And so that would be the difference between a mini facelift, a full facelift, including a neck, or just the neck lift. So I hope that's been at least starts the conversation about what are some of the different nuances with facelift surgery and what it is that we're trying to rejuvenate when we're performing the facelift surgery, and what different elements jump out and are the essence of youth and vitality. Thanks so much.